Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Cystine stones. Cystine stones are extremely hard stones. Because they are hard stones, it is difficult for these stones to be broken by extracorporeal shockwave lithotripsy. So it is difficult to be broken by extracorporeal shockwave lithotripsy, ESWL. Then these are mainly formed in acidic urine, and these are relatively resistant to fragmentation by extracorporeal shockwave lithotripsy. So in cystine, there should be definitely cystinuria should be there, right? Because the main cause of cystine is whenever there is increased cystine, if it is present in the urine, obviously this will result in cystine stones. Right, cystine stones occur whenever there is increased cystine in the urine. Second, typical ground glass appearance. These cystine stones are seen as 1 minute. Okay. These cystine stones have a typical ground glass appearance. They are actually hexagonal stones which are seen. So these cystine stones have typical ground glass appearance with soft, round, smooth outline, and these are typically hexagonal in shape, and hexagonal crystals are formed in the urine. In the urine they form hexagonal crystals, but in the kidney they look like smooth and round outline. Okay, so this is cystine stones. So cystine stones management is, first we should remove the stone. Second, first after stone removal we should decrease the cystine concentration in the urine. If we decrease the cystine concentration in the urine, automatically the stone will be decreased. The stone will not form, because once you have removed the stone, the second important thing is you should prevent the recurrence. So recurrence can be prevented by lowering the cystine concentration in the urine. This cystine concentration is lowered by giving low methionine diet, because if you give high methionine diet, methionine directly gets converted into cystine. So in order to prevent this conversion of methionine to cystine, we give a low methionine diet is given to the patient. Then we should alkalinize the urine. Why? Because cystines are formed in the acidic urine. So if you alkalinize the urine, obviously the cystine stones are not formed. Then you can also give some cystine complexing agents. These cystine complexing agents will actually combine with the cystine, and thus they will cause excretion of cystine. They will combine with cystine and they will cause excretion of cystine. So these cystine complexing agents are D-penicillamine, alpha mercaptopropionil glycine are the cystine complexing agents.
thank you and thank you for watching.